Hello, everyone. It is the September Lipedema Patient Roundtable. We have a hearty hello for all of you that are logging on. I kept seeing in the waiting room the numbers increasing and increasing and increasing. We're so glad that you're here. You're looking around the table and you're seeing familiar faces and you're saying one of these things is not like the other. And that's because we have a new friend joining us tonight. We promised you we were going to connect the dots between the process of wanting a pump, a Lympha Press, and how Lympha Press partners with you to get the therapy you need. This webinar every month is sponsored by Lympha Press. We don't often spend so much time talking about it, but in response to some of the questions that you've sent in, and Veronica Campbell especially, you wanted to know how that process happens. And the end result was our friend Marcia Witt, who is always one of our attendees, is here as our special guest. She recently got her Lympha Press. So we are going to be talking to those two and learning about that trajectory. September is Pain Awareness Month. All of you understand pain big time. And we're going to talk about ways that you can help manage your pain. Lympha Press is one of them. Anne Kahn is going to be speaking to us about that. Dr. Herbst has said that she will be with us making a guest appearance talking ICD-10 codes and what does that mean to you? What is the importance of all that? PGP is back in the game after having surgery, and you'll even hear her voice sounds better. It's almost been hard to listen to her in recent months because of the pain that her tonsils and her adenoids were causing her. So much. I could go on and on and on, but look at this. Look at everybody. Amanda Hadaway and Andrea Rogers and Angela Parsons, April Sluter. We are so happy to see Bonnie Newlin and Christine Roberts, Cynthia Mason. We could name you all. We're just glad you're here. 56 and counting. Let's get to it. I want to first say, Marcia Witt, big hearts, big love to you. You are one of the most inspiring people in the Roundtable family. And I have
Thank
to
you.
say, we've been doing the Roundtable for quite a few years now, and you just got a Lympha Press? It's like one of those, wow, I could have had a V8 moments. What made
Crazy.
you finally decide to move forward with this? And I'm sure it's not as simple as that. So let's
It's
talk.
not, it's not, it's not. So I guess I was diagnosed in October of 2020 with lipedema from a doctor up in Delaware. And he prescribed a different compression pump. Um, I I got it uh, at the cost of $2,800 for my copay at that point in time. Um, Tried to use it. I used it all of 3 times and immediately gave it away. And then could not get prescribed another pump, that are like, this is the only pump on the market. This is the only pump on the market. Then I started coming to the roundtable and heard about Lympha Press. And because I had gone through my insurance already, they would not prescribe a new pump. And I had to wait a number of years, and by then I had moved to New Jersey and I did not have a regular OT that would prescribe one. And it wasn't until I started going to Dr. Volstein for my surgeries. And he was like, what do you mean you don't have a press? You don't. And he's like, well, he's all about Lympha Press. And he's like, I'll get it prescribed. But that was April of 2023. And I just got my pump June, I guess, yeah, June, beginning of July. So of this year. So it took that long between his person, him saying I needed a pump and that he wanted me to use Lympha Press, insurance, waiting games, surgeries, some personal struggles. Then finally, I went to his office and I'm like, look, I need this pump. I'm in pain. I'm getting ready. At that point in time, I was getting ready for my second surgery. And he's like, well, you can't use it right after surgery. He's not one of the people that recommends using it, especially while you have open um addits, from the surgery. So he's like, you still need to wait a couple of weeks, but in the meantime, I'll push it. enter Lympha Press at that point in time. He filled out the paperwork and then put me with the local rep, Mr. David DiBacco.
So there's a few things to dig into here. I know several of the panelists, if you are using your Lympha Press regularly, go like this so we know who are the Lympha Press users here. Okay. And I want to know, for those of you in attendance, if you are using a pump, just answer yes or no. The reason we're bringing this up, this is not a commercial. This is about helping you manage your condition. If you are not using a pump, the Lympha Press can help tremendously with pain, which is one of the topics we're talking about tonight. It can help you with inflammation, mobility, and so many different factors. We don't want you to be dissuaded by sometimes what can be a journey to get there. Don't say, oh, because are you glad? Let's get to the end point, Marcia. Are you glad you got it?
Absolutely, absolutely. It's been a complete game changer. I posted on my personal Facebook and Instagram the other day, like my progression, right? From what before I got my diagnosis to midway point when I had my first surgery to, I guess, the last week, 2 weeks ago, maybe at the most, just the difference that, and I can't visually see it, right? I live with my body. There's body dysmorphia. There's all of those things, you know? And I had used the picture I posted. I had just gotten out of the pool because my boyfriend and I just put a pool in at our house. And I used the pump in the morning and then I was in the pool and I got out of the pool and I'm just like, I can't believe these are my legs. And I still need multiple more surgeries on my legs, but
Okay, so this leads into a funny story. Dave DiBacco, I'm going to you because okay, so if you attend the roundtable and I know your names and I adore you, right? So when I hear that you're in queue or you reach out to me, I'm like it white on rice, trying to get you connected with your local rep. And to my glee, it was Dave DiBacco, who, guess what, everybody? He's my nephew. Ha! So I'm like, David, Marcia Witt, are you on it? And your response was, David,
Oh, I thought you were going to say my response from our text thread. No, we got it done pretty quickly from that moment to the finish line, if my memory serves me correct. I know I've been listening to these roundtables for the last, 6 months or so, and I understand very clearly that a lot of the times you have to advocate for yourselves. But Lympha Press will help you do that. And, once I caught wind that Marcia needed a pump and we found out who the ordering doctor was going to be, we, kind of teed it up and it went pretty smoothly from there. So yeah, I was happy to help. It's an honor.
Well, but here's the thing. You called and mentioned that it was the pump company. And what happened? A funny story.
Yes. So this is after Marcia got her pump. So I wasn't able, my delivery contractor went out and got Marcia set up on it when we finally got it approved and sent to her because my delivery contractor could get there sooner than I could. But a couple days later, I wanted to check in and make sure everything went smoothly. So I sent Marcia a message and said, hey, just wanted to make sure everything's good with the pump. And she said, oh yeah, it's working great. We just added the chemicals. And I said, oh, all right, maybe some new medication along with the pump. Great, whatever works. And I asked if the wave setting was turned on to her knowledge, and the wave setting wasn't turned on because they had to put more chlorinator in to get the ring to tighten a little bit more because the ladder was too loose. She was talking about the pool pump. So, there's more than one pump out there, moral of the story, but it gave me a good laugh at least.
It was so good. And we are definitely not talking about the pool pump here. We're talking about the Lympha Press pump. I am looking at chat and I just want you to know that Lympha Press, the corporate office, is based in Glen Mills, Pennsylvania. They have a certain section of the country where they have direct reps, of whom David DiBacco is one. There are other sections of the country where there are associates that we do not have direct control over. If you ever have a problem with your rep, I want you to reach out to Lympha Press corporate directly. We will go to bat for you. We care about you, and we've proven it time and time again. So one of the things that the rep will help you do is navigate the insurance. How many of you have so much fun navigating insurance? Oh, it's such a joy, right? Yes, we all go like this. What's interesting about David's career is that you started out on the insurance side, understanding all the T's that needed to be crossed and the I's dotted. So how do you help and work with the clinician to get the insurance approved?
Absolutely. So every insurance company is different. We'll start with that. But generally, all insurance companies follow Medicare guidelines. So you can't go wrong following the Medicare guidelines. What we did for Marcia is once I found out who the doctor was that was going to be on board with prescribing, and that's step number one is getting a prescription, because the Lympha Press is a pneumatic pump. It's a class 2 medical device. So you need a doctor or a nurse practitioner's prescription. So that's step one. So what I had my case manager do was send a fax over to Marcia's doctor and say, hey, we received a request from your patient, Marcia Witt. You know, she showed interest in one of our Lympha Press devices. If you agree, here's what we need to get the ball rolling. And we sent over one of our order forms, and we also listed what her particular insurance company requires for an approval. And luckily, we were able to check all those boxes pretty quickly.
I'm so glad about that. And then what about you get the product, you get the device in your home? And I know for myself, technology makes me a little bit skittish. Is it difficult to use, Marcia? And did you have training on how to use the device?
So I did have training. The fun thing was, I set up the feet, like you can set up the feet to kind of lift up. And I'm short. I'm only 5'1". Let me just quantify that. I am not tall in any manner, but the way we had set up the feet was really painful for me when I was using compression. So I also didn't get the hang of the whole zipper thing because I was trying to get it up and down and all that stuff by myself because, you know, strong, independent woman, even though my boyfriend was probably right, 20 feet from me the whole time. I was trying to use it the first couple of times. And but turning it on, it just, everything started right up the way she had showed me how to do it. So yeah, she was here for a good 20, 25 minutes, going through all the settings with me, gave me a book to read. I'm not gonna, this is where I am like a man. I will not read instructions for anything. I figured if it's technology, that's my game. I will figure it out myself. So yeah.
So your first therapy session is not solo. Someone was with you as you did your first therapy session.
We stopped it a little bit because my dog came running in and jumped on both of us, but yeah.
Real life happens. Real life happens. Oh my goodness.
So now I
Wow.
have to make sure I close the door where the pump is because she loves to sit on that thing and she's 42 pounds of joy.
Oh my, and Jenny, I know you, and I think Kara, your pets also do like to have therapy with you when you're using your Lympha Press.
Absolutely. She either lays right next to me, or right on top, depending on what mood she's in. And I have a tip for Marcia on the zippers. I got like 10-inch zip ties and looped it through the zipper loop, and I use those to pull up the zipper. Easy peasy.
Well, so the rep that brought said, bring, get like shoestrings or do something.
Yeah.
And I found here, because I still am cleaning out stuff I just bought this house last year, like stuff that the people had left. And I found old drapery tassels, and those work really, really good. The long drapery tassels, because you can, like pull them up and down. But I was telling Patty the funny story. I don't know if you all want to hear the other funny story about Marcia and the pump is, when you have the pump going, everything gets moving, including your bladder, right? So I likened it to, I scuba dive. I have my scuba certification. And when you have your scuba certification, I have my deep water also. And your bladder, compresses just like when you're having the pump going. And so when you scuba dive, they say either you pee in your wetsuit or you lie about it, because you can't hold it. And it was the same thing the first couple of times that I was using the Lympha Press. I guess I went to the bathroom before, and I did the big 6, so I'm all open and ready to go. And I did not have those tassels on those zippers. And I'm like stopping the pump and I'm trying to run out. And again, my bathroom's like maybe, I can tell you it is 22 steps to get to the bathroom. And there was plenty of times I did not think I was going to make it even that far.
So for the good of the order, if you need to go to the restroom right after using your pump, it means it's working, right, Linda Ann? Because you're
Or during.
eliminating things.
Or during, have to stop it and
Or
go.
during.
Yeah, because when you start moving that lymphatic system, you will start eliminating and urinating, and that's what we want. We want everything to move. Same when you have your lymph drainage and then you have your pneumatic compression pump. Yeah.
Excellent. So, Marcia, I just want to thank you. We want you to be a part of the entire conversation. And also, David, we want you to stick with us. And if there's anything you want to add in, is there anything that you would want patients to know who have never used a Lympha Press? First, and then we'll get on with the rest of the thing. I want to get to pain management with you, Linda Ann. But Marcia or David, is there anything that you'd want patients to know about the Lympha Press? I know one question came in, what makes Lympha Press different from any other pump?
Well, I'll go first. So the last few months I've been on the panel of the Lymphedema Roundtable, but I really don't say much just because, like you said, this isn't a commercial for Lympha Press, even though these webinars are sponsored by Lympha Press. Pumps are just a small part of the puzzle, and I don't want to sound salesy or like, it's a big infomercial for us. But that being said, they are a piece to the puzzle, and they can really make a huge difference and be a really important tool in your toolbox, along with everything else. It's all about, maintaining the progress you make with your care team, and pumps can really help to do that from home. So, it's an honor to be here. And if anybody has any other questions for me, I'm sure Brenda will put my email address out there, and you can reach out to me personally and answer any other questions that you have.
Unique selling feature about the Lympha Press, though, what makes it different from another?
I could sit here all night and go through all the different specs, but I would say, customer service, and, I'll be the face of that tonight. So, I'll give it to you straight, and we'll always go above and beyond for you. No matter what battles the insurance company throws at us, we'll get it done.
And ease of use, I hear over and over. Kara, I see you putting your hand up. So jump on in there, PGP.
Yeah, I was going to say ease of use because I've used the competitor and I couldn't do it alone. My kid was like 8 at the time, and I was making him try to help close me all in and everything. So yeah, definitely ease of use. And I know somewhere in the archives there's a video of me setting it up and climbing in by myself that we can share and show. And that was, I think, only 2 surgeries in. So that was before the tummy tuck, before my mobility really increased, and it truly is easier to set up and get into on your own.
That video it's had thousands of views. Marcia, you used that video as well?
Yeah, I use that video. And then I also texted Kara, and I'm like, I've got company coming that needs to stay in this bed that I have the suit set up on. What do I do? And she's like, oh, you just put the pump in and roll it up like a sleeping bag. And I'm like, it's that easy. Too. And I mean, I was like, no, there's no way it's that easy. And it is that easy. But yeah, so that's the other thing, like storage and things of the competitor brand was not easy. Even though I only had it for a week, I knew that it was, even trying to box it up to give away for free was not easy. Wow. So I was so concerned. I'm like, what am I going to do with this big thing? How am I going to move it? And Kara's like, oh, just roll it up. And I'm like,
yeah, I literally fold the legs on top of each other like a pair of pants, start at the feet, and just roll it like a sleeping bag and put it in a laundry basket and then shove it in the closet.
Yep.
Here's something else I want to mention too. There is an option for any size human being. Lympha Press has expanders. We always recommend for lipedema the Lympha pants because they cover from right underneath your chest all the way down through your abdomen down to the bottom of your toes. But even if you have even if you are 400, 500 pounds more, we want you to have the therapy you need. There is a Lympha pod which can accommodate you. It looks like a sleeping bag, but it will literally compress your entire body. So please don't be discouraged. there are options for you. We would be honored to help you. And I think that that is the bottom line. We're here to help you and to serve you. And one of the ways we do that is with the monthly roundtable, something that we feel deeply about. And so getting back to our
Well,
regularly
just real quick.
scheduled program.
So just real quick though,
Yeah.
of talking about that, when I first got delivered, I had both expanders in, and because I've been using it on the regular, I'm down to 1 expander versus 2. So
And that's the fun part. Kara, have you changed expanders since that's awesome. That's so much fun. Wonderful. It's always great to see, you know what the best thing is? Feeling better. I remember Kelly from your group, Jenny Bogine, talking about how that heaviness, we think of pain in so many different ways, but for lipedema patients, often it is that achingness and the heaviness in the limbs. And she said that the pneumatic compression from the Lympha Press helped her with that. So let's talk pain for a moment. It comes in many different forms. And managing pain is a huge part of your life as a lipedema patient. I want to first talk to you, Linda Ann, because there are some things, perhaps, the tools in the toolbox that maybe we're not using that we could be using to get some relief.
So first of all, as we know, there's emotional pain, which is huge, which I'm going to address in a minute. And then there's the physical pain. Many of you know that I've been doing lots of talks on the fascia, and so has Paddy Cornute been studying the fascia, and I've been really digging deep into the fascia. And the fascia really is a source of pain. So if we can treat the fascia, we can really help a lot with the pain. And in the deep fascia and in the DAT, the deep adipose tissue, there is hyaluronan. And the studies are showing that hyaluronan, which causes the glide in the fascia, can actually connect with pain and with nociception as well as proprioception. So we want to have that when there's tension and pain, everything tightens up and then there'll be more pain. So if we can work with the fascia, we can really, really help with pain. I mean, there's a lot of things, but when the fascia is tight, as you know, there's pain, there's reduced mobility, there's decreased blood flow, decreased lymph. So we can work with that. So what do? We work with our foam rollers. We work with the massage gun. We work with gua sha. Those are some of the tools that can actually actively go on that, sometimes with balls, different balls. And I think it was Susie, it was either Susie or Patty who shared a while ago about soft balls. So I've got a whole kit of things that I show my patients what they can do. And I bought that soft ball that you spoke about, because if you're in too much pain, maybe the balls will be too hard. And then there is aromatherapy. So I'm actually lecturing next week in Nashville, Tennessee on aromatherapy in the fascia. So aromatherapy can help with many, many aspects. With the emotional aspects of pain. So working with Melissa or sweet orange or bergamot or rose will just help with that. And then the actual pain, bergamot, lots of studies and research bergamot can really, really help with pain. And then there's nociceptive pain, there's neuropathic pain. And so they're different essential oils. So you can work with peppermint, you can work with bergamot, with ylang ylang, with clove, with cinnamon. But if you do work with clove and cinnamon, you must use a small amount of the essential oil diluted in a carrier oil or in a blend, because they can cause irritations on the skin. So that's just really, really brief. I know we don't have a lot of time, to talk about everything, but just to think about the tools that you can do to help the restricted fascia. And as we know, the trauma is released tied in the fascia, and that causes even more emotion and pain. And then the essential oils, when you inhale, you go right to the limbic system of the brain and trigger thoughts, feelings, memories, and emotions. Bergamot is one, I could go on forever, but that's really good for the neuropathic pain and for emotional pain and helping you with sleep. So if there was one oil, that's what I would say.
I'm going to ask everybody what their favorite pain management tool is. But before we go there, I want to encourage you, if you have questions, put them in the Q&A. Some are coming in to the chat. I see one. How can we manage lumbar and joint pain? Linda Ann, do you have any comments on that in particular?
Myofascial release is wonderful to help with that. If you can find a John Barnes myofascial release therapist in your area, that is amazing, because it's we go in very, very gently and then stretch the tissue. So that's one way.
Okay, so pain management, your favorite pain management tool. Who wants to go first? Can I go to you, Patty? Because, I haven't heard from you yet tonight, and you're one of our favorite voices.
Well, for me, definitely movement, whether it's vibration plate, or we've been doing some plank this month in the group for a challenge that we've been working on. And just being able to, it gives you like an increased range of motion, and that really ties into the fascia. It's really the way that you're moving it to release some of those adhesions, and those are really what give you those pain signals, when the tissue is stuck. And if you can get that glide to happen, you really get a relief. But if there's like a cream, ointment, whatever, for me, it's always going to be magnesium oil or magnesium lotion.
We always say this, and I'll say it again because we always have some new names. It's not one size fits all, and not one method may work for all. I have seen in chat some people saying massage is painful for me. We need to listen to our bodies and know that what may work for one person may not work for another. We respect all of that. We just want to offer ideas to help you manage your condition. So thank you for sharing that, Patty. David, you noted something in the chat about the wave feature. What the heck is a wave feature for those that don't know? And that is unique to the Lympha Press.
Yeah, absolutely. So I probably should have led with this when you closed me down before, but there are basic pumps and advanced pumps. Basic pump, all it knows how to do is inflate sequentially. What that means is it starts filling up at the feet or the distal chambers. Once it senses pushback, it holds that compression and moves up to the next chamber, kind of like getting the toothpaste out of a tube. It slowly works its way to the top. So by the time it gets to the top, your feet have been squeezed the longest, and your thighs or your abdominal area will get the shortest amount of treatment. That can be comfortable for most people, but if you have something like lipedema, it's painful or sensitive to touch, that distal hold might not be so comfortable. So bring in an advanced pump like the Lympha Press Optimal Plus. It starts out, if you just turn it on and don't program it any special way, it works like a basic pump does, sequential treatment with a distal hold, but you can switch to the wave setting, which starts out the same way. It starts filling up down at the feet, goes up to chamber 2. Once it gets to about chamber 3, it releases chamber 1 and sort of stair steps and rolls its way distal to proximal. So if you can picture like a donut going up your legs, each part of the extremity gets an equal treatment. There's no distal hold. It's a way around, pain or sensitivity. So that is a huge difference, and what really separates Lympha Press and the Optimal Plus especially.
Thank you so much for explaining that. I think I see you nodding too, Patty. So do you use the wave feature on your Optimal Plus?
Yeah, because sometimes when you're doing it, my feet get painful. The way it's being held by the garment and the angle, sometimes I don't get it quite right when I'm filling it up, and I'll switch it to the wave.
Awesome. Love it. Great tip. Great tip. So Jenny Bogine, what is your favorite pain management tool, or something that maybe we haven't already talked about tonight?
There are a lot of tools in my toolbox. I will say I'm a big fan of it all, but the vibration plate I do every morning, to really get everything moving and steady for the right way for the day. And that also allows me to do some movement, which helps with stretching. But the other thing that for me and I see somebody noted it in the chat, is I actually use a CBD cream that's pretty strong on my arthritis pain. That's pretty helpful for me. And it's not for everybody, but for me, it makes a big difference. And it has arnica in it, which I'm sure Linda Ann would love. And I don't know whether it's the arnica or the CBD, but it works. So that's my go-to.
I love it. That's so interesting. What about you, Susie? You always are researching new ways to manage your condition.
Yeah, so I would just say that I have, because at my worst, my pain level was probably constantly between a 7 and an 8. To the point where, you know, you become reclusive because you have a resting bitch face 24/7 and everybody thinks you're just unfriendly, but you're just in pain. So for me, it's getting in the pool, doing the whole body vibration, absolutely wearing compression. That is one of the biggest game changers that I experienced for pain. And I just started with active fitness compression for those of you that are new here. For sure. And then red light therapy, I definitely do that. But the pool has been, for me, the biggest game changer. I don't have insurance and I haven't been able to get a Lympha Press, but I have a strategy to get one, but I'm going to be self-pay. So for that is going to take me a little bit longer. So I had to find alternatives. So getting in the pool and just even walking back and forth is like massive for me. So those are the things that I've been doing. And then diet. I really pay attention to what makes me feel like crap, and I don't eat it, even if I want to.
Isn't when you can connect those dots to something that I put in my mouth and how crappy I feel later, you know, and so sometimes it has to hit me over the head a few times and then it's like, duh, stop eating that, Brenda. So I get it, but that's a great tip. Angelique Charles, the lippy butterfly, we love hearing your voice. Tell us what's going on with you and how you manage pain.
My three main go-tos are, as we talked about before on here, I use medicinal marijuana to keep down that extreme pain, that neuropathic pain that I've had in my feet that made it like so excruciating that I wasn't able to bear walking. And then my daily routines that help me the most are, like Susie just said, getting in the pool. I run in the pool. I try to move as much as possible because I realized that the more I was able to move in the pool and in that water, the more compression was getting around my legs and stuff. So it was perfect. Hey, Karen Herbst, Dr. Karen Herbst. And the last thing that I use is the vibration gun. And to that extent, because I have a lot of fibrotic tissue in my thighs, especially, I do have to endure that first little bit of tenderness, especially when I'm having a really bad swelling episode. But I know that relief is coming on the other side. It's like one of those necessary pains that actually kind of feels good on the inside. And then after a while, I get what I call these releasey feels, and I can start to feel the tissues of my legs start to soften up a little bit, and the pain that was once there subsides into just gentle kind of like warmness for at least the next 24 hours until we're back at it again.
What a great way of explaining it. I love your way with words, Lippy. I want to go to you, Kara, but you know, the whole world stops. We just hit the pause button because Dr. Herbst is in the house, and we are always honored when you can join us. We appreciate the work you do so much. We know how busy you are. And there was a lot of chatter about ICD-10 codes and the importance of them for lipedema, how we can galvanize as a community and support getting this pushed forward. Dr. Herbst, if you don't know, and I bet you all know, she is the Chief Medical Officer for Lympha Press and an important part of our team so that we can serve you better. Dr. Herbst, great to see you. What can you tell us about ICD-10 codes? And by the way, anything else you want to tell us?
Thank you. I'm sorry, I'm all sweaty and gross, but you don't know that. ICD-10 code. So we presented a whole slug of codes. It was a lot. It was more, I think, than anybody else had, because we had to shift things around and add things and move things. And we had already comments on the presentation from the previous public and also the ICD-10 panelists. And a couple of big issues came up. One is stage 4. Like, what do we do with stage 4? And I'm going to go back in the literature and do some research on it, because stage 4 is really known as lipolymphedema. So lipedema with lymphedema. And that makes it very confusing for me, because if I have a patient who's really stage 2, but if she has lymphedema, then I need to call her lipolymphedema. And then she's really a stage 4, but she doesn't look like a woman who has stage 3 with lymphedema. They look very different. I guess maybe it doesn't even matter. So I'm really open to putting stage 4 anywhere that everybody wants it to go. I really just want these codes to go forward. I don't want to like take a stance and fight for stage 4 to be in a certain spot or not. I'm going to go with whatever the majority of people want us to do with stage 4, because I don't want to delay us getting codes anymore.
And Dr. Herbst, for those who may not be aware, what is the importance of having a code?
The importance of an ICD-10 code is that we can then say that lipedema exists, number 1, and number 2, we can direct care. So if somebody has if there's a true ICD-10 code, then this is a disease that we need to take care of. And then it gives a little bit of direction, like a stage 1 versus a stage 2. How we can, I have a patient who's got stage 1. It gives the provider a little bit more information before you even see the patient, so they kind of know how to gear up for that patient, especially like a therapist. It guides a surgeon on what kind of operation he might be doing on a particular patient. And then we made I was asked to put in the types. And then we ran into a problem with the types, like what is type 4? Is it arms and legs, or is it just arms? So types, I think, is important, because a lot of times in the literature, you see that it only affects the legs, or it only affects the arms in 30% or 80%. And so to be able to write down, yes, this affects the arms, here's the ICD-10 code for that, I think would be very powerful. And there's somebody on the panel, at the CDC panel, said, I don't think you need that. So do we need it, or do we not need it? And again, I think it would be very useful to help guide therapists and other clinicians and surgeons. But at the same time, if that's going to cause us to be so delayed that we never get ICD-10 codes, then let's take it out. So that's kind of where I am. I have not seen the comments yet. The comments closed October 10th. And so sometime after October 10th, we'll get the final comments, and then we work with the CDC directly to come up with the response and modify the codes we presented. And then we present it again in March of next year. So it's a really long process. And then someone on the panel does not want the code for lipolymphedema. They think we should just call it lipedema with lymphedema. And I kind of feel the same way. But again, if the majority wants a lipolymphedema code, then by golly, we have one right now, and I'll take it out if it's going to delay us.
So the path of least resistance to get to those codes is what I'm hearing you say. I want to thank you for championing this. Jenny, you had a question, because there is still time for the comment period, which means that everybody that's listening now can have their voice heard as part of this initiative. Jenny, what was your question for Dr. Herbst, so that we can get involved in the most effective way? And you are muted right now, Jenny.
I thought I hit on mute. I kind of would really like to know the best way to craft the comment. A short statement, just I support the ICD-10 codes for lipedema. Should we talk about our personal experience? Is there something specific we should say that would be helpful in the comments?
So basically the comments, you could write a comment and say, this is all great, I love it, thank you so much, we're done. But if the more comments we get for issues that you have with the ICD-10 codes that we've presented, the more work it is for us, and the possibility for a longer delay. So I think I think the more support we get, the better. but the more picky everybody is over it, the more work it is for us to collate it all together. And then again, that might delay us. And before I was in the group of, I need it to be absolutely perfect. We want everything and we want it perfect and blah, blah, blah. And now I'm like, let's get those codes. What do we got to do to get those codes and at least get one that says lipedema? Even if it just was one ICD-10 code for lipedema and that was it, I would be happy because then that makes it a real entity. But we have the opportunity to get so much more. So I've asked for a ton. If I need to back off a little bit, I will, but I'm just kind of letting you know that, negative comments about what we've written, unless if you really feel strongly about it, then yeah, we want to hear you because we're doing this, for patients to improve their care. And if you think it's going to affect your care and not be the right thing for you, gosh darn it, we want to hear from you. But if you're kind of wishy-washy about it and you're, then maybe just say, yay, and move on.
So
Thank you.
we so appreciate that. And while you're here, I'm going to try and get as much as I can out of you while you're here, Dr. Herbst. But does anybody have the link that we can put in chat for how people can register their comments? Jenny, would you mind doing that for us? And, there were a lot of folks, especially on the live here, that were at FDRS and they participated in the research with that you conducted. There is an errant person walking behind you, Dr. Herbst. So, hello.
Sorry.
No problem. It's kind of fun. So what's happening with that research that was done at FDRS?
I don't know. I was going to ask Jonathan Cart because I asked him, I'm like, well, am I just like a worker bee or am I going to participate in, processing the data and looking at the results and getting the paper out? Because that was a lot of work. And I think a lot of good data was collected and I have not heard anything. I am going to go to the Lipedema Foundation retreat, so I'll probably find out more there. And Jonathan does email me every once in a while about the ICD-10 codes. Right now, the only thing I care about are the ICD-10 codes.
I getcha. And we have put an invitation out to Lipedema Foundation. We definitely want to have them back soon to report back on all the things that they're doing. I keep seeing reports of new research being funded, exciting stuff. Dr. Herbst, I know ICD-10 is top of mind. Anything else that you would want to say to the lipedema patients watching right now?
I would say that, well, I'm excited about all the new research going on. My former postdoc, Sarah Godbon, just took a job in Virginia, and Shelley Krasinski did too. So those two are going to be working together. So I think that's going to be a dream team for lipedema research, especially because they'll be working directly with the surgeon who can get samples for them. And Sarah and I continue to work together or we're writing a paper together. So it's really fun. And also, I'm also getting very much so into the genetics. And it's not like the big genetics where you're going to find the gene for lipedema because I don't have that capability, but I'm doing personalized genetics and it's been really, really interesting because everybody is different. And it's not like, oh gosh, look at all these ladies with lipedema look exactly alike. It's everybody looks different and everybody has a unique gene or two or three or four. And I can't look at all the genes at once. So we look at particular things, but I think that using personalized genetics is really making a difference. And it's the next stage. And that in the future, you're going to go to your doctor and they're going to go, oh, I reviewed your genetics and blah, 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 blah. Or you can't take that drug. Your genetics says that you can't. And I read on the internet that in the future, like 10 years down the road, that junior high school students will be presenting their science projects on millions of people's DNA. And that's incredible. So we're the tip of the iceberg, but we're getting into this because we feel that women with lipedema need another tool to help them better understand their health and why they present the way they do. So
That is fascinating. Okay, so while we have Dr. Herbst, before she disappears, anybody on the panel have a question that they have been wanting to ask her, and this is your big chance. Yes, PGP, go for it.
I just had my tonsils and adenoids out. I still sound funny, but I was told through the ENT that they're part of the lymphatics now, or being classified as that. And mine were 3 times larger than he's ever seen. And I just wondered if there was something that I should really do to kind of keep them from the possibility of regrowth that I heard is an option, or if there's something now that they're gone I should really look for or worry about, or just your thoughts on them being part of the lymphatics and being enlarged due to lipedema kind of body.
So we think of lipedema as an inflammatory disease, right? And it probably is, but in a kind of a different way. So it's not like arthritis, although a lot of women with lipedema develop arthritis. I guess I'm not using good examples, but it's not like an infection. It's not like, well, it's not like you get a bacterial infection. It's a different kind of inflammation. Inflammation can be so different. Inflammation can fight off an invader, or it can be part of the repair process, and everything in between. So it may be that your body is just overdoing it in terms of your immune system. You're all like, if somebody was at a level 5 and that's normal, you're a 7. You know, so you function, your immune system functions at a 7 all the time. So it's overdoing it just enough, but not enough for us to draw your blood and go, oh yeah, there, you're overdoing it, because it's within the tissue itself. So it may be a marker that your immune system likes to overdo. In terms of the regrowth, they burn it, right? They burn the area, so it's unlikely to regrow, which is, you know, good news for you because they were so large. But it would be I would be interested to know, maybe and a different conversation, but about, you know, have you ever had swollen lymph nodes? Did you ever have a lymph node removed? Was your spleen ever enlarged? You know, these are other signs of overdoing. So I think you'll be fine.
And I'm so glad you're sleeping better, Kara, and your quality of life is better. We are thrilled about that. I'm going to throw a few more questions in here. People in the audience want to know what your thoughts are on GLP-1 medications for lipedema, Dr. Herbst.
I prescribe them all the time. You know, it's a pain to get sometimes. Some insurances refuse to cover it. Medicare doesn't cover it, except for some specific plans. But I think they work. I had a young lady come into me today, and we were chit-chatting, and she said, I have had 1 injection. And I go, okay, so you don't know, you know, what's going on. She said, I feel different. And I said, what do you mean you feel different? She said, my ankles aren't swollen anymore. And she goes, I just feel different. She goes, when I bend over, my stomach is, even though I haven't pooped, she said, I'm bending over and I can bend over a lot easier. So, you know, that's 1 injection. That's really amazing. And they're really great anti-inflammatories. So let's say that pale ginger pear is living at a 7, and that's just causing, you know, issues. It's causing fat to grow more so than it should. Now she's down to a 4. Well, she's now noticing that her fat's not getting that signal to grow anymore. So she's swelling less, and yada, yada down the line. It is a very potent anti-inflammatory. I do like them for lipedema. Some women don't respond, but that's as expected. That's what they found in the research studies. I will say that women are having less side effects with the tirzepatide, which is the Mounjaro Zepbound versus the Ozempic Wegovy. And the tirzepatide gives you a bigger bang for your injection because it's 2 hormones that are being affected versus just 1.
I saw you nodding, Patty, and I am so grateful for the people that are experiencing good results. I'm also heartbroken for the people who cannot get their insurance to cover it. And, you know, I'm hoping that that will change, because it is a game changer for so many people. A lot of people in the audience, Dr. Herbst, want to know, are you seeing patients? And if so, how can they get to you?
Yes, I am seeing patients in Tucson, Arizona. I am with the Roxbury Institute, and my phone number is 520-719-1610. So, and yeah, you can find me, if you look up the Roxbury Institute and put my name in, you'll find me and you'll get our phone number.
Okay. When you are looking at a patient, and Linda Ann, feel free to jump in on this one as well. How do you determine if it's lymphedema versus lipedema? This is an anonymous attendee. It's a question that we have answered in the past, but we love going back and helping some of our newer listeners and viewers to discern between the two. How do you determine if it's lymphedema or lipedema?
So I had a really interesting patient today. She's 74. She has, this is how our conversation went. She has lipedema, and her right leg was bigger than her left. And I said, okay, this, I'm thinking ahead. This woman may have lymphedema in her right leg. So we put her on our SOZO, which is our bioimpedance spectroscopy machine. And lo and behold, she had lymphedema of her left leg, not her right. And I went in the room and I said, by the way, it looks like you have lymphedema of your left leg, not your right. And she said, no, I have, my right leg's more affected. And I said, I get it, but it may be more affected just by fat. And I said, let's do an ultrasound. So we pulled out the ultrasound her leg. Sure enough, where is the fluid? On her left, even though her right leg is bigger. And she was just flabbergasted by that. She's like, oh my gosh, I would have definitely said my right. And I said, well, sometimes when you have lymphedema of one leg, that leg doesn't look so bad. It's the other leg that looks bad because that all the fluid is centered around the leg that has a functioning lymphatic system. Things back up into it, things backflow into it because it can't get into that left leg. So you can have a left leg that looks great. Your right leg is big. The problem's on the left side, but everything's flowing into the right. So the lymphatic system is a little bit, crazy that way. It can do different things. And unless you have a tool or a way to assess it, you can't figure it out. And I couldn't have figured it out by physical exam. Her stemmer sign was negative on both her feet. So I could just get skin. There was no fluid there.
Is it safe to say too that another marker is simply lymphedema is often unilateral and lipedema is bilateral? I see you nodding, Linda Ann. I'm hoping I'm okay having said that.
That's absolutely true. And what's Steve Dean from Wexler in Ohio did a research study on lymphedema, but he had a lot of women, 52 women, I think, in a study who had lipolymphedema. And there was this is his word, a proclivity for lymphedema to occur on the left side. And we're putting together a research study for Lympha Press. And we looked at how the Lympha Press optimal pump with the Lympha pants improved lipedema in women with lipedema. And we found out that when we were doing our SOZO bioimpedance spectroscopy, that there was more fluid in the left leg. So we put all the left legs in the study together and all the right legs. And I said, which one had more fluid? And definitely was the left leg. So what Steve Dean's study said was that there's probably some interaction between the vein and the arteries in that left leg, right in the groin area. And that's commonly known as May-Turner. And I know Linda Ann knows that very, very well. And so they said maybe there's a subclinical component of May-Turner in most people, and that causes the left leg to be more affected. And that may be the reason why there tends to be asymmetry in lymphedema and lipedema in terms of the lymphedema component.
I'm so glad you raised the fact that you are also doing research under the Lympha Press umbrella. That's one of the reasons why you are a chief medical officer.
Mm-hmm.
And it's not just the fact that you're a brilliant mind, you care deeply about the lipedema population, and we appreciate you so much right back. Toya Jones says she is having menopause kick her butt. Hot flashes are kicking her butt. What medications do you recommend to your patients?
I will say that I am not a hormone specialist, even though I'm an endocrinologist. I had to choose, like, what do I want to do? What am I most passionate about? And I'm most passionate about fat. And when you're passionate about fat, you have to be passionate about the lymphatic system, the blood vessels, and the fascia and connective tissue. And I just chose not to spend my time monitoring hormone levels because so many other people do that so well. And not as many people are looking at the fat and, you know, getting in there, and like I do, and Linda Ann does. And so I think there are a lot of medications available. And what I have found, and this is anecdotal, and this is not giving you advice, but women who go on hormone replacement therapy and are in a low dose and are monitored, their levels are monitored, so you don't become estrogen dominant, tend to do very well in menopause. And the recent studies show that if you start hormone replacement therapy right at the menopause, especially when you're having symptoms, there's really no major downside to it.
Go ahead.
I'm just going to say that I haven't seen a huge effect on, like, when someone starts hormone replacement therapy, haven't seen that the majority of women are having really bad side effects and are just growing crazy in their lipedema. They tend to grow crazy in their lipedema when they hit menopause. So it's not secondary to the hormones. And again, keeping it at a very low level, keeping it steady, and not letting those pulses happen, because the fat loves pulses of hormones.
Thank you for that answer. And Linda Ann, you wanted to jump in on that. And then we're going to have to close. So I want everybody to think of a sound bite you want to leave everybody with. Go for it, Linda Ann.
I just wanted to say that there are herbal extracts to use for menopause, like black cohosh, red clover, don quai, dandelion. You can use those, essential oil of clary sage. So there are those. I went on Chinese herbs when I went through menopause. So there are other options too.
Thank you so much, Linda Ann. Final thoughts for the audience, something to encourage everybody who took the time to log on tonight. It went by way too fast. We covered a lot of territory. Susie, can I start with you?
Absolutely. Especially since we have so many new people. If you've just been recently diagnosed with lipedema, just understand that you have an amazing community here. Dive into the historical patient roundtables. We oftentimes have specialists, and then it's an amazing opportunity to hear from people who have managed their lipedema. It can be managed, no matter how scary or hopeless it is. Between community and knowledge and putting those things into action, you can minimize it.
That's very encouraging. And it is true. I've seen it over the course of these last 5 years. So many hopeful stories. Jenny Bogine.
Take time for self-care. You know, we all spend a lot of time doing lipedema care, but take time for yourself, you know, to keep the stress down, you know, be it time with family, friends, crafting, walking in the woods, going shopping. Take time for yourself.
So, such a good reminder. PGP.
Just be ready to fight for yourself. Like, you know your body, you know what you're feeling. Don't let them tell you just diet and exercise, it'll get better. It can help. Don't get me wrong, it can help, but it's not like the cure-all for it, or it wouldn't have gotten to the point that it's gotten for a lot of us. So be ready to fight for yourself until you find the medical team that will listen and help.
Oh, that's such good advice. And you are all worth it to fight for yourselves. We are worth it. Patty Cornute.
It can seem very overwhelming, especially new people coming in and being surrounded by pumps and vibration and all these different options. Take a breath, let go of everything for 5 minutes, pick one thing. Pick one thing, see if it works for you, for your schedule, for your budget, for your condition, your symptoms. Do they get better? Do they not? Try something else.
That's great advice. Linda Ann, what would you say? Oh, you're muted, my friend.
Okay. When you're feeling stressed and you're feeling anxious, just remember to tonify your vagus nerve. You can do that by deep breathing. Breathe in for 4, hold for 4, release for 4, and you will actually tone your vagus nerve. You can also do deep humming and that really, really calms your nervous system.
Ooh, I'm going to do some humming as soon as we get off here. Lippy Butterfly, I'm going to end with you, but I want to go to Marcia Witt and Dave DiBacco first from Lympha Press. What would you say to our audience tonight?
Yeah, I just want to say, first and foremost, thank you for having me. It was an honor to be here. And I've been tuning into these roundtables monthly, and I've developed a very deep admiration for all of you. You're all very strong dealing with what you deal with. And, you know, whether I'm your local rep or not, my line's always open.
I appreciate that. Proud aunt here. Okay, and Marcia Witt, what would you like to say to the audience? You're usually on the other end of things, and here you are on the screen tonight. We're so honored to have you, our dear friend Marcia. What would you like to say to encourage everybody?
You know, this disease is very isolating. Everybody is different. It's like we're all snowflakes, and there's something different. What works for one won't work for the other. Everybody asks a lot of questions. Have you tried this? Have you tried that? And people give advice, and everybody has great advice. Don't isolate. It's something I do constantly. I fight my demons, my emotional demons, and concentrating on your emotional health is just as important as concentrating on the physical part of this disease. And find your people. I've got people in my corner that I call, I cry, I do. Just please remember, it is just about as much about the emotional and mental well-being as it is about the physical. And you can do it. You've got it. You've got cheering, you know, a bunch of people in your corner. I cheer you on, and so many others do as well.
One of the comments just came in from Casey Grosvenor. Marcia, you are my quiet hero and such a wonderful part of my circle. I love you. And we all send you so much love tonight. Lippy Butterfly, would you just close us out with some lippy love?
I was going to say, standing up for yourself does not have to end, and what your needs are does not have to end at the medical office. If you need Lifetime Fitness to clean the pool, you tell Lifetime Fitness to clean the pool. If you need a different table so that your hips fit in there, you tell the people at the restaurant that you need a different table. A lot of times we seclude ourselves because we don't want to speak up for what we really need in life. But in order to be active in life and to be present in life, you're going to have to stand up for yourself and what you need. So go ahead, let your voice be heard in not just the medical's office, but everywhere that you go.
Fantastic. And so with that, we're a little over, but man, was it worth it. Thank you everybody for tuning in tonight for the live Lipedema Patient Roundtable. There was so much good chat. Oh my goodness. And many of you will watch the replay because it was really good stuff to dig into. Thank you everybody. You are appreciated. You are valued. You are worthy. You are wonderful. Have a great night. See ya.